future at UMBC.
State Circle is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Connecting Marylanders to their government. This is State Circle.
Good evening. Welcome to State Circle. We begin this week with the latest local information on the coronavirus outbreak. About 1,700 Marylanders are now hospitalized. That compares to 1,425 this time last week. Nearly 1,100 people have died in Maryland. Last week, the death toll stood at 723. Testing is being expanded on the Eastern Shore as hundreds of poultry workers have tested positive. Around the country, 30 million people have filed for unemployment benefits, and pressure is building to reopen the country. Our Nancy Amata spoke to Marylanders about that dilemma.
I think everybody's thinking the same thing. I know I am. I think it's just about time to start, getting the economy rolling again myself.
Damascus resident Walt Sikora says he'd like Maryland to lift the stay-at-home orders that have kept residents at home and non-essential businesses closed for the last 5.5 weeks.
I really feel for the people out there in the small businesses that are really suffering right now.
Would you feel comfortable going into a restaurant right now or, going into a store just for non-essential shopping?
Yeah, I think I would, yeah.
I would love to see it. There's a part of me that feel like there might be a premature, jump on things. But I think that maybe by now, I think that most of the people are probably immune to, whatever's going around. They say herd and usually get immune to it. So maybe I think that in about time, maybe.
Around the country, as federal guidelines expire, 31 states are partially reopening over the next few days. This as Governor Hogan introduces what he calls a safe, gradual, and an effective roadmap to recovery. He says Marylanders should continue to avoid crowds and practice physical distancing. In Germantown, half of the shoppers we met and interviewed from 6 feet away say they agree that it's too early to talk about reopening non-essential businesses.
Because there's no cure. We don't even have enough testing. It's just very early in the game for it to be effective.
So you're okay with staying home?
Not okay with staying home, but I don't think we're ready. We're there yet.
In fact, a Washington Post University of Maryland poll suggests Americans overwhelmingly support state-imposed restrictions on businesses and the size of public gatherings to slow the spread of the coronavirus.
Of course we need to get back to work because it's bad, but you only got one life, so it's best that you try to take care of it. Yeah, these times are hard, but it'll get better.
Ian Moore agrees. He's a pathologist that works at NIH and studies influenza.
This could become a seasonal recurrence, which is why the vaccine will be so important once one is developed.
He says now is not the time for people to feel complacent or take unnecessary risks.
Somebody is subclinically infected, so in other words, they're not showing clinical signs. You could be around somebody once again, we start to relax these restrictions. People come back together, next thing you know, 4 or 5 people start getting infected, they go back to their homes, and that's how it starts to take off again.
Some prisoners in the state's correctional facilities are being released early to limit the spread of the virus within prison walls. Our Charles Robinson reports.
There are winds of change blowing at the Jessup Correctional Facility. Loved ones of those who are languishing behind bars are getting a reprieve through an executive order signed by the governor. There are critics and champions of releasing prisoners. Tell us a little bit about how many and the how and the why.
Well, the Department of Public Safety and Correctional Services did, I think they threw out the number of around 700 people that would be technically affected by this order. But I think that number may fluctuate depending on who they're looking at. The why of the order, why it was so needed and why the advocates pushed so hard is because correctional facilities are a hotbed for a pandemic like this.
For critics of this program, this is not a get out of jail free card. Instead, there will be specific criteria that will be used to determine who can be released. Some have called the prison system in the state a coronavirus petri dish. There are no social distancing protocols nor readily available cleaning products for inmates to use. Guards, like prisoners, are vulnerable. Advocating for the release were two powerful individuals, the state's attorney from Baltimore City and the Maryland Chief Judge of the Appeals Court.
To have that support, that backup, it was just invaluable to us, not just from State's Attorney Mosby, but Chief Judge Barbera, the ACLU, all of our partners that we work with.
The governor agreed and began the process to send those not seen as a threat back into the community.
The special election process to fill the congressional seat of the late Elijah Cummings was completed this week, with most of the ballots arriving by mail. Former Congressman Kwesi Mfume is the projected winner, with nearly 3/4 of the vote over Republican nominee Kim Klacik. We had a chance to speak to the former and future congressman today.
It's a great opportunity to serve again. I'm very much up for it, looking towards it. And particularly at this time in our nation's history, when we are beset by this horrible virus and looking at what it's doing to our people, our plans, our institutions, our economy, and our lifestyle. So it's a very, very important time, I think, to be going into the Congress to try to work shoulder to shoulder with those persons who are already there, state by state, to make a real difference.
If your predecessor in this seat, who was also your successor, and your good friend Elijah Cummings had been alive in the last couple of months, what would we have been hearing from Congressman Cummings?
Well, knowing Elijah as I did for 42 wonderful years, he would be in the forefront of reminding people why it's important to keep the democracy intact, why it's important to take care of the citizens of the country, and why it is extremely important for us to use science, common sense, and data to find a way to get our way out of this situation. So Elijah would have been then, as he was for many, many years, a real voice of reason in the middle of this kind of crisis, one of which we've never seen before.
Your district, 7th district, the lines change over the years, but it's still a majority-minority district, about 60% African-American. African-American community in Maryland, especially hard hit, as you mentioned, by the coronavirus. The census data, the last census, about 31% of the state African-American, but 44% of the people who are dying from this disease are African-Americans. How does that hit you? What's your response when you started hearing that information?
Jeff, I'm really not surprised at the disparity of the statistics and what we see every day in terms of the numbers. Over the last 10 years, I spent 4 years of that time at the National Institutes of Health, serving on their Institute of Minority Health and Health Disparities. It was there that we tried to ring the bell with respect to the disparate impact of cancer, both breast cancer and prostate cancer, cardiovascular disease, kidney disease, hypertension, HIV, AIDS, obesity, asthma, so many things that were disparately affecting African Americans in our state and in our society. And our belief then, as it is now, for me at least, is that in order to understand the disparate impact, you have to understand that we've been struggling for a long time, many of us in the community, arguing that special attention needed to be paid, particularly where people have comorbidities and pre-existing conditions. I also spent some time as the executive director of the National Medical Association, ringing the bell there as we represented African-American physicians across the country. And more recently, I have served, and I'm still serving, as vice chair of Research America, the largest research advocacy organization in the country that, again, is ringing the bell saying, look, we've got a problem here, and the problem is the disparate nature of disease in our society. And so someone said, and I think it bears repeating, that crises, epidemics, and pandemics don't create disparities, they reveal disparities. And the disparities have been revealed strikingly so as a result of this virus, which has hit all of us, but has hit Black people disproportionately in our society for all the reasons I've just stated.
So, I mean, immediately, what can we do? I mean, the state is building, expanding facilities, a lot of activity in Prince George's County, which is not your district. So, you know, short term, more testing maybe, long term, where does the focus need to be?
Well, I'm looking forward to working with Governor Hogan, with County Executive Olszewski, County Executive Ball, and the entire Maryland congressional delegation on trying to find a way to assist them in dealing what they are dealing with, both economically and in terms of the health crisis. But I think there are a couple of things that have to be done. Number one, testing is extremely important. You can't find people unless you're looking for them. And when you find people who are affected, whether symptomatic or asymptomatic, it gives you an opportunity to do the right kind of quarantining. I don't want to say I have a problem with, but I think what we need to find a way to do is not just to have stationary testing sites, one in this zip code, one in that zip code, et cetera. I believe we need mobile testing, the same way we have fought against maladies in our communities before, whether it's been hypertension or anything else. Mobile vans equipped with a physician, equipped where possible with nurses or nursing assistants, but with the ability to go out and to test all day long in a mobile fashion, as opposed to waiting for people to come to where the site might be.
Thinking about your district some more, it stretches out. You mentioned County Executive Ball in Howard County, Olszewski in Baltimore County, and of course parts of Baltimore City. And we've been focused on the city part a lot lately because the 5-year anniversary of the death of Freddie Gray this week, I think. That community where Congressman Cummings lived and an area that had been hard hit, maybe didn't fully participate in the economic boom that unfortunately seems to have just ended. How do you think about that part of Baltimore? And then at the same time, your service on the board, chairing the board at Morgan State, which seems to be doing great. It's this incredible engine of success. Tale of two cities, still the case.
Well, it is, and it has been for a long time. I remember being in the Congress years ago when the other Governor Cuomo gave the famous speech about the city that sits on the hill and how it was a tale of two cities. It's been that way a long time. It continues to be that way, unfortunately. I remember the 1968 uprising following the death of Dr. King on April 4th that year, and the disparities that existed became full-blown when people thought that no one cared, that no one really looked at them, that they were sort of invisible and therefore had no worth and value. When those sort of things happen in the minds of people, whether what they think is right or wrong, it usually leads to an explosion. And so here we are 5 years after the death of Freddie Gray. And when you look at the conditions in particularly the neighborhood he came out of and some of the adjoining neighborhoods, and when you look at the level of despair and you look at the level of neglect and you look at the level of hope that people there still cling to, they still have hope. It says a great deal about their resiliency, and it says a great deal also about what we have to come to grips with as a society, and this notion of having two tales and two cities and two different looks at what's going on. We need an economic Marshall Plan for cities across this nation, not just Baltimore. And I've been advocating for some time now a $16 billion approach to do that. That may have seemed like a lot of money before, but now that we are in this pandemic and billions and billions and billions of dollars are required to make sure that people are provided for and that businesses are sustained, it is not a lot of money. It's the right thing we ought to do, and it's an investment and a down payment on our future by trying to save the lives of people, making sure that they are productive citizens, and making sure that the inequities that existed in those neighborhoods that exploded are done away with. Otherwise, it's all talk. There's got to be real lasting action. And what better time now, faced as we are with this pandemic, and so many different needs to recognize that we've got to build up all sectors of our society, because all sectors and all communities are important. For me, it's a great opportunity to represent, again, that area, to represent Howard County and Baltimore County, and to represent a number of people who are Black and white and Latino and Asian, old, young, gay, straight, those who live in inner cities and those who live in suburban communities. I've tried throughout my campaign, and I believe this fervently, that we've got to find a way to get beyond focusing only on our differences and to find a way to focus on our similarities. Because at the end of the day, we probably all want the same thing. We want a better life for ourselves and our children. We want a world that has a sense of compassion about it. And we want safe streets and safe communities and the ability to grow and to grow old together. So it's a daunting task, Jeff. I would not lie to you and say that it's easy. It's not going to be easy, but I didn't sign up for easy. So I'm looking forward to it, and I'm looking for an opportunity to learn again.
Congressman Mfume, past and future Congressman Mfume, thank you, sir, for the time.
Thank you very, very much. I do appreciate it.
It was learned this week that half of the state's coronavirus fatalities have been nursing home patients. One home in Mount Airy was among the earliest and hardest hit, with 29 lives lost there. We spoke with Carroll County Health Officer Ed Singer.
When COVID-19 seems to get into these facilities, it seems to spread, and it's hard to stop the spread. We put a lot of things in place. We've actually got teams from our local health department that we stood up that's specifically pushing out all the guidance from the Department of Health and CDC and the resources to try to support these facilities. You know, it's really the facility's responsibility to be communicating with the families and the patients about what's going on in the facilities and what they've put in place. But there are a lot of really good plans and a lot of good supports out there now. I'll give you an example of one of the facilities we're dealing with right now, and I don't want to name the facility, but they essentially have they've set it up so that their facilities divided. They have an area where they know, and this has to do with a lot of the testing support and these strike teams that have come in to help people in what we call cohorting patients. And they've got a section of their facility where they have known COVID positive patients, where they're essentially have those patients and a dedicated group of staff that are working with those patients. And then they have an area where they've got patients that they're unsure about, where they're placing these patients so that they can kind of keep an eye on them, and they may be infectious, they may not be infectious, but if they start to show symptoms and they get tested, they may wind up in the COVID positive ward, or if they stay well for a period of time, they may wind up in with the patients that are well. And then they have another section that is essentially for the well patients. And that's really what we're trying to do in some of these facilities when we have these outbreaks, is to separate those out.
I was going to say, and you think about the patients. You mentioned they're obviously got to be scared. They're dependent. The people working there, it's not the most glamorous, high-paid job in medicine, but it's got to be among the most risky right now. Where are you finding people to put in?
It's a difficult thing to do, but our hospitals and the Maryland Hospital Association and whatnot, and the Maryland Department of Health and OHCQ have tried to provide tools. I mean, like I said, when we started with this, there weren't a lot of tools out there that were available. So we essentially put all of our staff together trying to call staffing agencies, and some of the people would show up and they'd turn around and they'd like, nope, I don't want to be here. And I think now we've gotten to the point where people know what they're getting themselves into, and that type of thing. But there's also resources out there where there are databases where you could essentially pull from a whole bunch of different nursing resources and whatnot to look at getting staffing. And the state's also stood up some teams. We have these teams that they have that are a response team that are from the National Guard, they're from the federal level, they're from hospitals. They can come out and do assessments on these facilities and help figure out who needs to be tested, and if everybody needs to be tested, maybe provide some testing support. The staff there haven't normally been used to operating in a PPE type of environment, just overseeing their PPE, use of PPE and their infection control, and helping provide some support there. So those teams are very important. And just a couple of days ago, the governor announced that they have stood up some teams that could actually come in And if a facility is in crisis, and we could have really used these back then, if a facility is in crisis, they can implant essentially a team through the local health officer and emergency manager. They can implant a team of nursing staff to go out and man a facility that could essentially be there for 4 days while the facility works to stabilize their staffing situation. And I think that's one of the most difficult things that these facilities are facing. When you don't have stable staffing and you don't have your key people, you get into all kinds of problems like who knows how to access the medications that the patients need. And, a lot of them have fingerprint type scanners and things to limit access to medications, and just who knows where the oxygen is and how they do the oxygen supplies and things of that nature. So when their normal staffing is deteriorating, the state has done a lot to help provide tools to help them figure out how to get additional staffing. And then if they are in crisis, these teams that can come out there and essentially be put in place to help them have a chance to catch their breath and figure out a staffing pattern so that we don't get into a crisis mode.
The coronavirus outbreak has impacted our plans to produce a debate in the Baltimore mayor's race, so we are interviewing candidates individually. This week, our Sue Copen caught up with candidate Mary Miller.
What makes you the best candidate for mayor in Baltimore?
I think it's my status as a political outsider, but someone with deep roots in Baltimore. I've lived here for 34 years. I've worked in the community, in the private sector, and the public sector. And I just think I bring a set of experience and background to bear here that's particularly important at this moment in time in Baltimore.
Speaking of this moment in time, the COVID-19 battle has taken a tremendous toll in human cost, economic toll on the city. What, from your background, do you bring forth to try to get the city back on firmer footing?
So I have a deep understanding of Baltimore city finances from my years running the municipal bond department at T. Rowe Price, the Maryland Bond Fund, which invests all over the state of Maryland. But I also agree with, I think, something you said, which is the coronavirus pandemic has laid bare the frailties of this city, whether they are economic, whether they are public health disparities, whether they are access issues, such as access to the internet for children who are trying to learn at home, whether it's access to the internet for people who need medical care and cannot reach telemedicine. This is really a deep illustration of the problems Baltimore faces. And I think the coronavirus time gives us an opportunity to come back stronger and to come back differently to address some of these inequities in Baltimore. And that's what I would like to do as mayor.
Well, let's talk a little bit about the city itself. As you know, population has been leaving the city. And it's a city that has, I think it still has, the highest tax base in the country for its assessment. How do you rectify those two?
So I think you're referring to the tax structure in Baltimore. For example, our property tax rate is twice that of the surrounding counties, which makes the city uncompetitive. I think what this city needs to do is to drive a very strong economic development program, and as I say, to go for growth. Unless we can grow our tax base by providing good jobs in Baltimore, keeping more income in the city, we're not going to be able to pay for the things that we need to pay for. I'm a supporter of the Kerwin Commission recommendations to invest more deeply in public education in Baltimore. That is going to cost the city more. So I think we need to make a lot of investments to grow the city's tax base so that we can make our tax structure more competitive. I've said I want to lower the property tax rate in a responsible manner to attract more investment in the city. But the real key, I think, is to raise income in the city of Baltimore and to derive more of our revenue from income taxes from people who are living and working here. If we can do that, we will not only materially benefit the residents of Baltimore who have been left behind, but we'll also build that strong foundation really for financial success for the city.
What do you think are the city's biggest sales points in finding the right businesses to make that happen?
We have a tremendous locational advantage on the East Coast, Port City. We have tremendous educational institutions here. We are a leader in healthcare. The world is watching the evidence that Johns Hopkins is putting out every day on the coronavirus. So we have enormous resources here. We also have a terrific nonprofit sector that is lifting a lot of load in Baltimore in terms of serving our citizens in our city. We need to put all that together in a way that we can attract people to Baltimore. I think that we need to attack our crime problems, which are legion and are known throughout the country. I think this is the time for a mayor who's really going to attack crime as the emergency that it is, resolve those issues, and make it a much more attractive place for people to live and work in Baltimore.
Finally, should you win the primary and the general, what is the first thing or the first two things you intend to tackle on your first day in office?
The first thing would be building a team in the mayor's office that is really set up to be accountable and effective as running a city government. So we need more resources on efficient and equitable city service delivery. We need to change the culture of city government and the way we deliver services to our citizens. I would put in place a stronger economic development force in the mayor's office. And I would particularly focus on equity and inclusion by creating a deputy mayor for that role in city government. And finally, we need a strong person leading intergovernmental assistance. Baltimore cannot do this alone. We've got to work with our partners in the federal government, in the state government, and in all our surrounding counties. So we need much bigger bridges that could be built through the mayor's office.
Mayor Miller, thank you so much for joining us.
Thank you. It's a pleasure to be here.
For all of us at MPT, thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
Shore United Bank, serving Maryland's Eastern Shore for over a century. Today we serve both sides of the Chesapeake Bay, providing personal and business banking services. We are committed to helping you achieve your financial goals. Shore United Bank, good things are happening here.
Some things are inevitable. Diabetes doesn't have to be. 84 million American adults are living with prediabetes and 90% of them don't know it. To learn your risk, take the American Diabetes Association Type 2 Risk Test.
Do you have legal questions? Visit mdcourts.gov/videos.